My name is Michiel Stijbos. I'm a medical oncologist practicing in Antwerp at Augustinus Hospital, focusing on GU cancers.
Brilliant. Thank you for joining us. First of all, could you tell us about what you've learned this weekend in ESMO?
I think the biggest thing that I've learned is that the game for patients with bladder cancer has changed tremendously. We've been giving the same chemotherapy for 23 years to patients that are not in a great shape and had no other option. And yesterday we saw the presentation by Tom Powles on the EV302 trial that completely changed the game. That's so exciting. I was in the audience. It's not often that you see a standing ovation for the presenter. Crowd went wild. It was the best presidential in my entire career.
Brilliant. Yeah. And anything else you've learned over the weekend, or any new trends you're seeing emerging?
Well, from another perspective, I think that what surprised me, and I'm actually really happy to see, is that we're moving more and more to real-world data. Practicing oncologist working group from ESMO had a fantastic session on how randomized phase 3 trials, even though they're the golden standard, have severe limitations, and the outcomes that we see in those trials don't necessarily reflect efficacy in real world. So the fact that we're moving more and more to looking at those real-life patients, not the very selected patients in clinical trials, I think is very good. I like the trend.
Brilliant. Great to see. And is there anything you learned over the weekend that you'll bring into your practice next week?
Yeah. As soon as we have it available, I'm going to put all my patients on enfortumab and pembrolizumab in bladder cancer.
Okay.
Complete game changer.
Excellent. Brilliant. Thank you very much, Michiel.
My pleasure.